Speaking of folks staying up late, I think that
Yes, we do.
our
We have
next
Dr.
guest.
in East Germany, Lebanese medical doctor and public health researcher, joining us to discuss the germ warfare aspect. I don't know what else to call it, Rania, of what's taking place there in Gaza.
There, it's Anise.
Hi, Anise. Thanks so much for being with us.
Hello, thanks for having me.
Well, really an honor to have you and to have you back. Of course, great episode of Rania Khalek's Dispatches, which you were also a part of. But maybe for those who didn't see that and who have only seen sort of the headline that disease is stalking Gaza, maybe just give us maybe a capsule view of the impact that disease is having on those who are still trapped in the Gaza Strip.
Well, in terms of the infectious disease profile that's happening in Gaza, it is an absolute disaster. And it is not an unexpected result, considering that Israel is purposefully targeting any kind of healthcare facility. A couple of days ago, the Ministry of Public Health of Gaza said that they only have 6 ambulances left. And people can just imagine what that means in terms of the healthcare system being able to go to people who are in need of aid. And they started off with 70 ambulances. Now they're down to 6. These ambulances are barely functional because there's no gas being allowed into Gaza. People are cramped. Millions of people cramped in the south of Gaza. This is a recipe for any kind of infectious disease. And I think your viewers would understand. So if one of their parents or their family members gets sick, eventually a week or 2 later, they will develop the same sickness, whether it is the flu or something even more dangerous. I think around today, the Ministry of Health counted around 8,000 cases of hepatitis A. This is a disease that is contracted due to poor sewage. Already we know that there is around 500 people that are using the same bathroom in Gaza, in the south of Gaza, only in the quote-unquote safe zones. These are the spaces that are under the protection of the UN, that Israel bombs at will, attacks at will, has no respect for them at all. So considering that one bathroom is being shared by 500 people, we can definitely imagine how many diseases are being contracted. And it is not a question, I mean, I have to say this because of the racist statements that are coming out of Israeli officials, but it is not a question of individual hygiene. It is a question of the environment in which these people are forced to live under. No person can afford to have their own personal hygiene or like the certain standards of personal hygiene in the conditions in which people in Gaza are living today.
They don't have water to drink. They certainly don't have water to wash their hands or shower in. I mean, people are going, I don't know, there's people who haven't showered since this started except to go jump into the sea. It's utterly shocking. Anise, I'm curious can you put this in the perspective of, it's horrifying. Obviously, this is genocidal, but it's also a pattern in terms of what a colonizer does to the colonized. I mean, this sort of, what did you call it, germ warfare?
Yeah.
It's not new. Using disease to try to kill more people off. Can you talk about that aspect of it, and also maybe touch on the fact that when we talk about people being exposed to all kinds of diseases under these conditions, we're also talking about people who already have compromised immune systems because for 100 days they haven't had regular access to the necessities of survival.
Yeah. So, I mean, the idea of biowarfare is not a new concept. It is definitely something that is taken out of the Colonial book. I'm assuming both of you guys are in the US, you understand the US history, and we know very well that the colonizers, gave indigenous populations there these sheets that were infected with these viruses that came from Europe, and the indigenous population in the Americas was not used to these viruses. Their immune system were not accustomed to them, and therefore this is what caused major casualties in the millions. Whereas colonizers actively killed a couple thousand, the millions of deaths were because of disease. This contact of a foreign infectious agent to this indigenous population. Differently, though, in Gaza, what's happening today is that with the knowledge that we have today, with the advances in medicine and in science that we have today, and with globalization, despite all of these facts, today Gaza is a completely insular environment. So All the electricity is given by Israel, the water, the food, the humanitarian aid, the lab tests, the medication, everything. And we've seen it. And it's the proof to that fact is when the Israeli authorities decided to seal off Gaza completely, it happened overnight, which is unachievable unless you have full control of the area. And ever since then, we've seen them promote all of the necessary ingredients to create this disastrous recipe of promoting infectious diseases in Gaza. We've already, the Ministry of Public Health already counted thousands of cases, hundreds of thousands of cases of respiratory diseases, gastrointestinal infections. And it doesn't take a scientist or an expert to know that when you cramp a lot of people in a very small area, these people have been bombed, they are homeless, they haven't been fed for more than 3 months, they don't have access to their medication. Eventually, these people will develop a series of infectious diseases, and people with chronic diseases, their conditions will start to decompensate. So when you do not have access to clean, drinkable water, there's some reports that a lot of Palestinians have resorted to drinking seawater and drinking water from agricultural wells. So if you already have, let's say, chronic kidney disease, and around 1,000 people in Gaza were counted as people suffering from chronic kidney disease, these people haven't had access to dialysis, to their chronic medication. And on top of it, you are drinking water that is polluted with heavy metals, with a high concentration of salts. All of this will accumulate in the kidneys. It will exacerbate this condition. People with cardiovascular disease who need to be on anticoagulants on a daily basis haven't had access to this medication. Women who are pregnant, these women need access to supplements. They need access to improved dietary intake. They need regular checkups for the ultrasounds. I mean, anything that we take for granted as people living in a regular society, they have no access to it. And there is no example that we can take from history, because in that sense, it is exceptional, because it is not a population that doesn't know their health requirements. It is not a population that out of their own hands, they cannot afford to have access to these things anymore. This is being purposefully created and inflicted on a population by another one. And in that sense, we cannot truly predict. I mean, so far there have been some predictions, and I think they might be even worse, that around 500,000 Palestinians in Gaza will die within the year. And that does make sense. There's this professor from the Edinburgh School of Public Health that made their estimate, and it is a valid estimate, because we know already today that in conflicts, for every single individual that is killed as a direct consequence of the conflict, so whether they are shot, bombed, killed directly through military conflict, there are 15 others that will be killed or through the public health consequences, and that is access to food, healthcare, medication, anything that we have access to in a normal functioning society.
I mean, one of the points that I think you at least sort of touched on it obliquely, but I just want to speak to here is with the destruction of medical facilities, it also seems that, perhaps things we don't even view, those of us who have access to healthcare as, potentially fatal or potentially dangerous, like diarrhea or something like that can actually start to metastasize and become much more dangerous. I was hoping you could talk a little bit about that too, because I think sometimes people see some of the words and they think, oh, well, that doesn't sound that bad.
Yes. So we already know that the amount of people that have been killed in Gaza are above 25,000. The people who are injured, lost under the rubble, we still don't know. We don't have a legitimate estimate on the number of these people. So I will take a regular case. Let's say somebody was close to a building that was bombed by Israeli forces. They escaped, but they have a large wound on their arm. They have to go to the hospital to get sutured. If the wound is dirty, it will have to be cleaned in the hospital. This patient will have to be on antibiotics for at least a week, and then they will have to check back in 10 days to remove their sutures. All of this is not accessible in Gaza. So the antibiotics are not there already, and this is not something new. This is something that has been reported on during the first month of the war in Gaza. Already Ghassan Abu Sitta showed us with a picture how he is cleaning wounds with white vinegar, and this is archaic medicine. This is not something that anybody willingly would subject themselves to, and no doctor would willingly prescribe their patients at all. But this is definitely something that they're being forced to do. And so definitely then the wound, if it is not cared for well enough, if it gets infected, and knowing the amount of bombing, the amount of dust that is released by this complete destruction, not just of buildings, but entire neighborhoods, and the access to clean water is absent. So definitely there will be other waterborne infections, foodborne infections, because people were forced to eat rotten food if they can even have access to it. So then the problem becomes that when we have these preventable mortalities, so we have a very simple disease that can be cured with a couple pills of antibiotics, or like a simple wound treatment and then some suturing, none of this is acceptable, is fixable anymore. So then the mortality rate will increase exponentially for the most minor diseases. So even if you catch a flu today in modern society, people don't die from the flu unless they are immunocompromised, if they have other kind of diseases, or if they're very young or very old. Otherwise, people who are healthy have no reason to die from the flu or from dysentery. And this is definitely happening today in Gaza. So in that sense, Israel, despite the huge number of deaths that we haven't seen today in recent history, the true number of deaths will be projected into the future. And at that point, Israel's responsibility will be seemingly not present. They will be like, yes, but these people died. We have nothing to do with that. We did not shoot them. We did not bomb them. But they definitely made sure that all the circumstances are there for them to die from the most simple ailments.
You know, Anis, when I had you on my show, you mentioned something about how you couldn't understand how so many Israeli doctors signed that letter, essentially saying that Gaza deserves this because it goes against everything that you're supposed to do as a doctor. And one thing you're not supposed to do, right, is do no harm. But I'm just curious, given everything you just said, I mean, you mentioned you don't have to be an expert or a doctor to recognize that this is a health disaster. What's happening internationally among various medical organizations, if anything? Is anybody releasing statements? Is anybody pressuring or talking about this in those circles on putting a stop to this, or how to address, things after, the day after, as they call it, when eventually this genocide comes to a close?
As much as I think, there is power in unions to pressurize their governments towards a specific political outcome, and specifically in this case, declaring the government declaring themselves in favor of a ceasefire. Today, it doesn't really matter, especially when we have millions of people across the world protesting constantly to pressure their governments to declare themselves in favor of a ceasefire. However, there have been some declarations. One of them being in the Union of Nurses in the U.S., which is definitely something that we definitely respect, but it truly doesn't matter. As you were saying before in your previous segment, you don't always need an expert to tell you what's right and what's wrong. And even though I am a doctor and a public health specialist, it has nothing to do with the common sense. It is when you take everything away from a population, it's going to cause more deaths. And you don't need an Israeli doctor to tell you that this is fine. Bombing of ambulances, healthcare workers, and hospitals, and the faculty of medicine in Gaza, for you to believe them that maybe this is right. No, this is absolutely wrong. And nobody else can tell you that. And you do not need an expert to be told that. There is common sense, and common sense does work. If you feel that it is wrong, it is definitely wrong. And I think people across the world already understand that this is something that we haven't seen in around more than a century in human history. However, they also understand that this is a huge danger for everyone. The idea normalizing bombing hospitals, normalizing starving population, normalizing removing their access to any form of healthcare. This is something that people understand, because then they will project themselves into that same situation, and they will know that the rules of war, even though war in itself is horrible, there are some rules to guarantee some bare minimum. And today, the bets are off. I have no idea how future conflicts will be waged after what Israel has done to the Palestinians of Gaza.
Dr. Anish Germany, Lebanese medical doctor and public health researcher. Thank you so much for giving us some of your time here on the Freedom Side.
My pleasure.